is Dr. Salah, your friendly neighborhood dentist at Pearl Dental Clinic in Business Bay. Now, for our first live session, we are going to discuss about Invisalign and how Invisalign works. All right. So, for those of you who do not know how the Invisalign works or what the Invisalign is all about, it's an alternative to braces. Braces are typically the metallic brackets that's placed on the tooth surface and a wire that helps the teeth to move. Now, there are a lot of patients who do not want this metallic braces, and what are the other alternatives? One of them can be the lingual braces, which is placed at the back of the mouth. The other one is the removable aligners. Now, one of the most branded ones, or one of the most, I should say, the familiar one is the Invisalign. Now, how does Invisalign work, and does it really work? So the process is like we will clean your teeth, we'll take a scan of your teeth, and we will upload them onto the software just like this. And once they are on there, we prescribe Invisalign what kind of results are we after, what kind of movements do we prefer, and we will come to know a lot more metrics. So what I'm going to do now is I'm going to walk you through the process of how we design a case scenario. So I'll give you, I have here loaded 3 cases, all of which are mine. So I'll start with one, and this guy came in with a gap, as you can see. I don't know if it's easy enough. Ashik, can you see that? Yeah, okay. So the guy came up with a gap on his upper front teeth, which he did not like, obviously, and he's looking for solutions as to how to close this. Now, this is a very wide gap for us to do. We close it up with veneers or bonding. Veneers can make the teeth look much more wider. So the only other option is to have the teeth move. Now, he don't want braces. He's constantly traveling. He has a lot of engagements. So he was looking for something that's easy. We introduced Invisalign to him, and we took his scan, and this is how it looks like. Once the scan is uploaded, and once we run the system, and when we click play, as you can see here, in a way, like how the teeth is going to move. So again, you can see like how the teeth actually moves into the direction. Now, here you can see that we have arranged in a way that we only moved one side. Why is that? Because he has a midline shift. This tooth is in the center, but whereas this tooth has gone far to his left side. So what we, through Invisalign, we locked this area up, and we kind of moved all of the segment here so that his midline will be much appreciated. So what's the result? Here you are. So this is the result. So his gaps are closed, nice and tight, and it's very good. It's a very good result. We send it for refinement to close that very tiny gap out there, and also as you can see, the teeth is slightly inclined, so we can shift it. So we have asked for additional aligners to get that sorted. Another case scenario, very difficult case, which I have done, is a tooth that is overlapping the other. Very crowded. Some of her teeth are like actually pushing outwards. Now, this is a very challenging case. So if you can see how an Invisalign can transform this case into a nicely perfected arch, then obviously Invisalign can do anything else. All right. So we plan this case, we run this through the system, and this is how it looks. So as you see, the simulation shows us how the teeth can move. So once we applied that, we did it. And another thing that I wanted to share is like how much aligners will it take. So here, as you can see, it's 21 aligners. Within 21 aligners, which is roughly around between 200 days, her aligners are, her case is closed, right? And this is what it looks like. Not a perfect result. There's still one tooth to go inside. So this is how Invisalign works. So we took a new impression or scan, send it back to the Invisalign, and we will reprogram it in a way to get that lot more perfected. So this is how an Invisalign works. So the first time that they come in, we get a lot more movements, but then later on, like if there is any refinements, if you want to move anything nicer, we can still do this. Another case Again, very complex case that I've done is, this is called an open bite. As you can see, open bite is a case where the patient's mouth is open and they cannot close the front teeth. So this is called an open bite. So this kind of cases can also be easily corrected. Now, with typical braces, we will have to remove 4 of her teeth in order to have this closed. But with Invisalign, we were able to achieve a very good result for her without having to remove any of her teeth. So this is how she looks like when she came in first. And this is, if I run the simulation, this is how it will look like. Very beautiful results. As you can see, like, oh, it looks great, but does it actually look in real life? So this is how she came in once she completed it. So you can see, as you can see, it's like near perfect results. Very good. We have sent it back to the Invisalign to get this more corrected. But look at her lower teeth. Now this is what I would like to show you. As you can see here, the bottom, the lower teeth are perfectly aligned over here, as you can see here. Her before, let me pull that out, and you can see how crowded they were, and this is her lower side. Before, you can see how crowded they were, and this is like after. It's like perfect. In her real photograph, it looks amazing. So this is how Invisalign, if you are concerned if the Invisalign really works, it's like each aligners have to be worn 10 days, and every 10 days you pass through the aligners for it to complete. Now in this case, it's like, which is a complex case, it took us 23 aligners to start off with, which is roughly around 200. Like we rescan, we send it back to the Invisalign, and we get more additional aligners to get them all finished. The finishing improvements. Invisalign also allows us with a mid-course correction. If it's not going according to the plan, we rescan, we send it back to the Invisalign, and we get a new setup and a new direction if things are not going according to the plan. Invisalign also comes with the comprehensive cases. Invisalign comes with 5 years of treatment timeline, which means that it does not mean that your case can be, it can take up to 5 years. Say for example, we did 2 years of treatment, and later on, if there's something that needs more correction, further correction, or there's something called relax. Relax means the teeth moves back into the position if the retainers are not worn. After the active movements, all our patients, just like braces, have to wear removable retainers or a fixed retainer, which is like kind of a lingual bar or a bar that's given at the back of the mouth, like this way. So these are to help to hold the teeth in this position so that they don't move back. Now, in case in the eventuality, like the bar broke off or the retainer broke and the patient was not able to come back to me earlier, we can still send this case to the Invisalign and get additional aligners just to get that sorted. So these are all added advantage. Now this system is world class, and I've worked with many other brands, aligners and everything, but none comes closer to this. I have done so many cases, and I've got all of my cases have got excellent results, and yeah, that's it. So if you are one of those guys who are thinking about Invisalign and taking a step back just because you are unsure, hope this video makes sense and brings much value to you. Please share this video if you can with all of your friends, and hope to see you at Berlin Clinic soon.
We have one question from one of the viewers. The question is, how well does Invisalign work in a healed bone after extraction?
Okay, that's a very good question. I have done so many.
This question is from Rashida.
I have seen so many cases like that. I have actually done one case where it's completely healed bone, and this tooth was actually removed a long time back, like while she was a child. I don't know if I can pull this out. If you can give me a second. That case is of she has a very complex case. She has immense crowding in the front tooth, and then the only way is like to we have to remove a few teeth in order to have that corrected. But since she had one of her tooth done, removed long time ago, what we were able to do is like shift all the teeth into that space and close them and close the space. So she has two-in-one results. One, the gap closed and her teeth was aligned itself. Let me see if I can pull her case up. It's a very interesting case. Thank you for that. Yeah. So, and she's a live example. So if I can show you some, the treatment is currently ongoing. If I can show you some of her cases, like and how, hopefully that will answer your question. Yes, it does work. Invisalign also comes with for the doctors, like for me, it's not only about the cosmetics. It's also about the health of each individual teeth, right? So. With Invisalign, I can have a controlled movement of the teeth, so to make sure that the teeth are not affected. So this is the case that I was talking about. Here, as you can see, there is a good, nice gap, and this gap has been partially closed because this tooth was removed long time ago, and as you can see, this tooth is slightly inclined towards the gap. So this usually happens, the tooth movement usually happens. If there's a tooth missing, the tooth at the back kind of moves or shifts inside. So what we do, this is what we have planned for her. So we kind of moved all the teeth backwards to and eventually close the gap. Not only that, like we were trying to upright this case as well. So this is how we started her off. Unfortunately, I can't show you the photograph because where it shows her face. But I'll show you what happened once she completed the first series of aligners. Again, this case is ongoing. Very happy patient, very good results. Let me see as it comes up. Like I'll just quickly go back to some of the case that she had. It's just not the gap alone, like say so this is how she came in. The only contact, again this is an open bite case, the only contact for her is at the back. As you can see, there's only one point contact, and the rest of her mouth is completely open. Now this is, she was not aware of this. She just came in to me just to have her upper jaw fixed and her lower jaw aligned. But when she came in, I showed her like what's her problem and how we can correct them with Invisalign, and we are almost near correction. So this is how she looks right now. Big difference. As you can see, the gap is closed. Okay, I can show you her pictures maybe sometime if you are coming now. But you can see this is a case after we have started off. So this is before. Here, this is before, this is how we started her off, and there are 40 aligners in this case because it's a long case. We move it very slow and gentle so that it takes time for the case to be finished. And this is how she came in after the 40 aligners. So we took new set of aligners, that is 27 aligners, to give that finishing touches. And again, the bite is not closed down, so we have to close the bite more. And this is how things are working for her. So I'll show you another view of how she came in. So now from here, we are kind of trying to improve things. As you can see, I'm rotating this tooth to make it more straighter, giving that final finishing touches. She's already happy with the results. She's very happy, she's very excited because her primary concern as to she wants to have her teeth all aligned is achieved. Now I have to push the patient into further aligners just to give that finishing touches and also to improve her back. But she's very happy, no pain, no problems. All her teeth are very healthy, never encountered any issues. So this is Invisalign. So we get a lot of matrices, we get a lot of information, feedbacks from the software as to what kind of force is applied to the tooth, how far the tooth moves, and what kind of force can be applied to the tooth so that it is safe. So it takes a lot of aligners. The 40 aligners means it takes about 18 months roughly around a year and a half to to complete them. But then the end result is going to be awesome. Another thing, like people are scared of, like, okay, there are 40 aligners, which means it can take longer time, right? And some of the one other question that I get from most of my patients are, Invisalign is faster than the braces. It is faster. There's no doubt about it. But again, it depends on the cases. So some cases, which is small cases, yes, we can finish it in say 2 months, 3 months. But cases like this, which is like super complex, very difficult cases, it actually takes time, because it's apart from the cosmetic side, it's also about how the teeth moves, and the health of the teeth is very important. So once the teeth moves, once it's finished, it's not done yet. So there is a lot more finishing touches, finishing attachments. Now what I want to share with you is, like, even though it is 40 aligners, she started to enjoy her smile right halfway through. So this is another beauty of Invisalign. So you get to start to enjoy your smile, not at the very end like braces. So if you are going for braces, the braces has only once you remove all the braces, it's like when you start to enjoy your smile. But with Invisalign, halfway or more than halfway through, you already start to enjoy your smile, because you can see good results. And every month you get a better smile. This is what I tell my patients, and they always laugh about it. So which is true, which is actually true. So I hope that has cleared your question with a live answer. Anything else that I can help in your questions?
All good.
All right. So thank you for watching, and I hope I will be back and will be very consistent in sharing much more treatment details with you in future. Thanks for watching.